My name is Dr. Isaac Powell, Professor of Urology at Wayne State University, Karamanos Cancer Institute. And I am a specialist in urologic oncology, and my primary interest is in prostate cancer research and clinical outcomes.
Dr. Powell, as an African American physician who has specialized in the treatment of prostate cancer for many years, are we getting better at dealing with this disease in the African American community?
Yes, we are. In fact, the cancers we're now seeing are earlier and therefore more treatable, and the outcomes are significantly better.
Are there specific priorities that you think we need to focus on more that would help to reduce the risk of prostate cancer among African Americans?
Yes, I think that we could have an educational program focusing on diet, particularly early detection. I think those are the two most important things that we need to convey to the African American community.
Do you have an opinion on whether the incidence of prostate cancer in the African American community is driven more by genetics or more by lifestyle issues?
I think that there's a combination of genetics and lifestyle, particularly diet. I think that that plays a major role. We're now learning that such things as hypertension and obesity play a major role in the aggressiveness of prostate cancer. That is something that we can control and we need to focus on. However, genetics also are important factors. Hereditary prostate cancer is an important factor, but it is not the major cause for prostate cancer.
How do you counsel your own friends and family members about prostate cancer risk today, given the results from the recent screening trials and the continuing media focus on whether screening is appropriate?
Well, I certainly have a bias towards those trials. I think that the trials had significant limitations. I think they were prematurely reported. Their design suggested that they should continue the trials until 13 years, and both were finished significantly earlier than that. In the American trial, there was significant contamination in the arm of the patients who were not supposed to get PSAs. 50% of those patients got PSAs. So therefore, I think the conclusions are significantly limited, and I question the validity of the conclusions, particularly the American study. The European study did show that there was a difference in the men who were given PSA test, and they did find a difference. However, they also found that in those men who were later in the follow-up, the difference in death versus those difference in death in the men who had PSAs versus those who did not was increasing. In terms of my counseling to my patients, I give them my biases. I tell them about the studies as much as I can, and that they can understand. And I say to them that I think they should continue to be screened and tested for prostate cancer.
Are there other observations about prostate cancer that you would care to comment on?
Well, I think, again, I want to say something about diet, because that's something that we can control. I think we need to reduce the fat in our diet. There's definitely evidence that the high-fat diet is associated with an aggressive prostate cancer. I think that's the most important thing. And I would certainly condone early detection by use of the PSA and digital rectal examination.